Okay. Today we're going to talk about two really fun subjects. Well, maybe not. Cancer and HIV. Last week we talked about heart disease and diabetes. So I guess compared to, well, who knows? Anyway, okay. So we're going to talk about cancer today, and we're going to talk about HIV, maybe if we can get that far. We'll see how far we can get. Cancer is a set of diseases in which abnormal body cells multiply and spread in uncontrolled fashion, forming a tumor. There are two types of tumors. One is benign cancer, which is non-cancerous. It's controlled. It is encapsulated. The human body controls it by encapsulating it. And the other is malignant cancer. This is unchecked cancer by your immune system. It's considered cancerous. And anytime we find a malignant cancer, we have to destroy it in one way or another. Usually by surgery, but sometimes by chemotherapy and radiation. Cancer is the second leading cause of death in the United States. Metastasis is a process which malignant body cells proliferate and spread to other parts of the body. Now, normally, when you are dealing with a cancer, as long as you can control it, then it will not metastasize. But you have to control it where it has developed. So, if you have lung cancer, you need to keep it in your lungs. If you don't keep it in your lungs and it metastasizes, then it will go. It can go anywhere. It can go into your brain and kill you. But of course, a lung cancer can kill you. But what I'm trying to say is, once something metastasizes, then your immune system won't be able to work to kill it, to eradicate it at that point. And the reason is because when a cancer metastasizes, the way it's able to metastasize is by creating the same substance that a growing baby produces. When a baby is first formed, it is a single cell, and then all of a sudden it splits, and it's two cells, and it's four cells, and it's six cells, and the mother's immune system would kill it. Except for a substance that it produces called human chorionic gonadotropin. Human chorionic gonadotropin protects the growing baby, the growing fetus, the growing zygote. Protects all the cells. And strangely enough, it is the human chorionic gonadotropin that you measure when you pee on that clear blue easy stick. That's what you're measuring. You're measuring the amount of human chorionic gonadotropin that has been released by the growing zygote in your urine, into your urine, and that's what you're measuring. Well, unfortunately, cancers, once they decide that they're going to move, or once that they have grown as much as they want to in a certain area, they will start producing human chorionic gonadotropin, and at that point they are kept from your immune system cannot see them because of the human chorionic gonadotropin, and that's what metastasis is. Anytime something metastasizes, all of a sudden your immune system is blinded to it. Carcinoma is a cancer of the epithelial cells. The reality is that we have epithelial cells everywhere. The inside lining of our bodies are epithelial cells. The outside covering of our body are epithelial cells. They are any place that you have an opening in an organ is an epithelial cell. 1 in 6 people in the United States will have a carcinoma. I've had a carcinoma. I've had skin cancer. Um, Breast cancer is a carcinoma. Prostate cancer is a carcinoma. Lung cancer is a carcinoma. Colon cancer, of course, is a carcinoma, as is pancreatic cancer. A sarcoma is a cancer that strikes muscles, bones, and cartilage. About 2% of cancers are sarcomas. Almost all the cancers that you have will be a carcinoma. But of course, there are other types of sarcoma. Lymphoma is a cancer of the body's lymph system. It includes Hodgkin's disease and non-Hodgkin's lymphoma. About 74,490 people or 74,490 people were diagnosed with lymphoma in 2009. So it's not an uncommon cancerous growth. Leukemia is cancer of the blood and the blood-producing system. And there you go, the 4 different types of cancers: carcinoma, sarcoma, lymphoma, and leukemia. Many individual factors such as gender, age, and ethnicity will affect susceptibility. As you grow older, your cells aren't able to repair themselves, and sometimes they will become cancerous. And of course, the older you are, the more likely that the genes in those cells are going to malfunction, and you're going to develop a cancer. Prevalence of different cancers varies by age group. 1 in 2 men will develop cancer in their lifetime. As I said, I've already developed cancer, skin cancer. Thank goodness I don't have any other kind of cancer. 28% of all cancers diagnosed in men will be prostate cancer, and there's a reason for that. I probably won't tell you why. But 28% of all cancers are prostate cancers. 20% of all deaths from cancer are lung and bronchus cancer, though they represent only 14% of diagnosed cancers. 1 in 3 women will develop a cancer in their lifetime. 29% of all cancers diagnosed in women will be breast cancer. 26% of all deaths from cancer are lung and bronchus cancer, though they represent only 14% of cancers diagnosed. In the United States, cancer is the second leading cause of death among children between the ages of 1 and 14 after accidents. African Americans have the highest incidence rates for cancer in the United States. African American women historically have been less likely to perform regular breast cancer screening. African Americans tend to have less access to health insurance and healthcare facilities. Ethnic differences in diet play a role. African Americans do tend to consume fattier diets. African Americans have a 60% greater chance of contracting cancer than other minorities in the United States. And that's usually because of their poverty. Now, you may ask yourself, well, what's wrong with black people that they don't work? Well, the answer is for the longest time, African Americans have been denied labor. They have been denied jobs. I used to live in the South, and even when I was living there in the 1990s, it was rare for somebody to just hire a black man off the street. It just wasn't done in the South. Well, unfortunately, most of the black people in the United States live in the South, and down there, in the past anyway, maybe things have improved a bit. I haven't been down there for a while, but for the longest time, they couldn't find jobs, especially black males. Black females, it was a little easier for them to find jobs, but usually low-paying domestic jobs. The black males were not allowed to work because white males are afraid of black males. Not that they're going to hit them or something, but they have these really strange ideas that black men are rapists and whatnot. African American males have high rates of lung and prostate cancer. African Americans are 33% more likely to die of cancer than European Americans. And here are the cancers as far as men and women are concerned. As you can see, breast cancer and prostate cancer are the most prevalent forms of cancer in both men and women. Breast cancer is a reproductive cancer, as is prostate cancer. And the reason for this is because reproductive tissue is very delicate. And since it is so delicate, if it is abused or if it's not used properly or at all, it's supposed to be used. That's the reason it was put there. Then that area may develop a cancer. Women who have never breastfed are more susceptible to breast cancer than women who have breastfed. Men who abstain from sexual activity are more prone to prostate cancer than men who have regular sex. men who have contracted a sexually transmitted infection are more prone to prostate cancer. I guess I did tell you about prostate cancer. Lung cancer in both men and women, about 14%. Colon and rectal cancer for both men and women, about 9%. The urinary tract and the bladder in both men and women, about 6%. For men, it's melanoma is next because they spend so much time outside, especially white males. The paler your skin, the more susceptible you are to skin cancer. For women, it's thyroid cancer. For men, 5% kidney and renal pelvis. And that has something to do with alcohol, by the way. 4% non-Hodgkin's lymphoma, 3% oral cavity and pharynx because they smoke or chew tobacco or dip snuff. 3% leukemia, 3% pancreas, 14% all other sites. For women, it was 4% non-Hodgkin's lymphoma, 4% melanoma of the skin, 3% ovarian cancer, 3% kidney and renal and pelvic cancer, and 3% pancreas, 19% other sites. This is deaths. For both men and women, most cancer deaths are caused by lung and bronchial cancers. For men, 10% prostate cancer. For women, 14% breast cancer. Colon and rectal cancer, 9% for both of them. Pancreas cancer, 6% for men, 7% for women. Liver and intrahepatic bile duct cancer for men, mostly because of drinking too much alcohol. 5%. For women, it's their ovaries are 5%, leukemia is 4%, non-Hodgkin's lymphoma is 3%, uterine corpus is 3%, liver and intrahepatic bile duct, because they don't drink as much as men do, on the average, of course, 2%, and brain and other nervous system, 2%, 24% other sites. And you can read it for yourself as far as men are concerned. Epidemiologists estimate that even if we lived in a world where all environmental carcinogens could be avoided, like tobacco and alcohol, or poisonous chemicals, 25% of the cancers developing now would develop anyway. These cancers would develop because of uncontrollable genetic factors and biological processes. A carcinogen is a cancer-causing agent such as tobacco, ultraviolet radiation, or an environmental toxin. Tobacco use is implicated in 1 of every 5 U.S. deaths. Tobacco is the single most lethal carcinogen known to man. Most tobacco-related deaths result from cancer. Tobacco use is also linked to cancers of the mouth, the pharynx, the larynx, the esophagus, the pancreas, the uterus, the cervix, the kidney, and the bladder. Now, this is really kind of weird because when I was born, it was against the law to say anything negative about tobacco. The tobacco lobby was controlling the U.S. government and even U.S. scientists. It was against the law for them to say anything negative about tobacco. It wasn't until the 60s that we first discovered it. It wasn't until the 70s that we stopped tobacco that's when we first started putting labels on cigarette packages saying that it was a cancer-causing agent. When I was young, for some reason, I've told you this before, I was fascinated with why people died. I was worried that my parents were going to both die in an automobile accident. I was just scared to death. So I used to read the obituaries all the time, trying to see when people died. I didn't want my parents to die. So I used to read the obituaries. And back then, of course, they used to tell you why people died. And it was not uncommon to see people dying in their 50s and 60s of lung cancer. And normally, well, they just died of lung cancer at an earlier age. I told you that my life expectancy when I was first born was 59. And now, of course, it's in the high 80s or 70s somewhere, like 78 or 79. That's mostly because we've stopped smoking so many cigarettes. Half the population smoked cigarettes, and it was killing them at a relatively young age. But like my friend, who said he would rather die young than give up his cigarettes, than give up the pleasure of his cigarettes, he died young. So there you go. He got his wish. Recent polls showed that of graduating seniors, 42.2% have tried tobacco and 10.7% report smoking every day. Often the deciding factor in adolescent smoking is whether the parents of the teen smoke. Research seems to show that if the parent quits smoking before the child reaches the third grade, the individual is less likely to see the behavior as acceptable. And that's one of the problems that we have is children see their parents doing the wrong thing, and if they continue to do it until they're older, the children will accept that as acceptable behavior. Once upon a time, there was an author by the name of Kurt Vonnegut Jr. When he came home from school when he was 17 years old, he found his mother dead. She had committed suicide. For the rest of his life, every day he thought about killing himself. Why? Because as far as he was concerned, it was acceptable behavior. He had seen his mother commit suicide. She'd always been a depressed person. She'd always suffered from probably bipolar disorder, but back then, of course, they didn't diagnose bipolar disorder. His mother wouldn't allow her picture to be taken, as weird as that may sound. And she would, even if she agreed to have her picture taken, just as the individual was about to take the picture, she would drop down flat on the floor and wouldn't allow her picture to be taken. Because children are young and their brains are not fully developed, peer influence and identity formation are key factors in tobacco experimentation. Just as adolescents identify with those they socialize with, particular behaviors can become internalized as a personality identifier throughout their life. They can identify themselves as nerds or as athletes or stoners or somebody that gives somebody the finger or brainiacs. I was identified as three of these four. The one you can take out is stoner. I was a brainiac, I was an athlete, and I was a nerd, as weird as that sounds. Once again, because of the immature and adolescent brain, teens are more susceptible to the addictive properties of tobacco than people who wait till they are 21 to try the substance. Thus, adolescents who start smoking are more likely to become regular smokers. Diet is second only to tobacco as a carcinogen. 1/3 of all cancer deaths are attributed to poor diet choices, types of what type of food do you eat, how the food is prepared, deep fat fried. When I was living in the South, they didn't just fry their food; they deep fat fried their food. They double fried it, and everything was fried. It was just soaked in grease. Tasted pretty good, but of course, it was not really very healthy. A lot of people overeat. They eat until all the food is gone. They eat too much. Whether the diet is balanced or not, and of course, this is a balanced diet. As you can see, you need to eat fruits, vegetables. You need to eat dairy products and take in meats. And if you take in too much sugar, you're probably in a relatively negative situation. Calorie intake, of course, how many calories are you eating? If you're getting your calories from saturated fats, probably not the best idea. Cancer is more prevalent among people who are malnourished, people who consume high levels of fats, people who consume certain food additives such as nitrates, processed food. If you're a jerky freak, that's not very good. The jerky's not very good for you, especially the stuff that they sell in the stores. If you make it yourself, then you're probably okay. It's mostly red meat. It's not there's not that much fat. But if you're eating, those big packages of beef jerky, there's just tons of nitrates in there. Hot dogs have tons of nitrates in them. Smoked sausage has tons of nitrates in it. Anything that is processed meats. And of course, alcohol is another cancer-causing agent. Diet can reduce the possibility of cancer. Reduce intake of foods and drinks that promote weight gain, such as saturated fats and sugary drinks. You can do this, then you have reduced your risk for cancer. Eat primarily plant-based foods. Plant-based foods are what everybody has been eating since the dawn of human existence. So these are good foods for you. Limit intake of red meat and avoid processed meats, especially processed meats. The red meat, not a bad idea. That's okay. You can still eat the red meats as long as that's not all you eat. Limit the consumption of alcoholic beverages. A little bit of alcohol is okay, but a lot of alcohol is not okay. Reduce intake of salt and moldy grains or legumes. And of course, the reason you shouldn't eat moldy grains has to do with gluten. Possible food links to certain cancers are those that affect the cells that line bodily tissues, including those in your lungs, your colon, your bladder, your stomach, and your rectum. I used to do urinalysis from time to time. Didn't like it, didn't want to do it. But I was good at it because I was thorough. One of the things that we used to do was we'd take a test tube full of urine and we'd spin it down, and we would get the sediment, and we'd dump out the urine, and we would look at the sediment to see what was in the sediment. And mostly it was epithelial cells in the sediment. Your stomach is lined with epithelial cells as well, and your rectum. To a lesser degree, the uterus, the prostate, the breasts, and the kidneys. And of course, foods can cause cancers in all these areas. Soy foods contain isoflavones, which can act as estrogens in the body, and these are known as phytoestrogens. The degree of difference between naturally occurring estrogen and phytoestrogen is significant, but the added estrogen to women could increase the level of estrogen to a carcinogenic level. This is especially true of breast cancer. So this is something that women need to be aware of. If they are lactose intolerant and they drink soy milk, then they need to drink it in moderation. If you remember the episode of The Big Bang Theory, Sheldon was talking about how Leonard was a crybaby and how he acted like a woman sometimes, and he said he thought it was because he drank too much soy milk. And of course, soy milk does have phytoestrogens in it, and therefore it could raise your estrogen level. Men have estrogen as well as women do. This is one of the things that happens when individuals drink too much alcohol. As we said last week, if you drink too much alcohol, then it raises your estrogen level and lowers your testosterone level. So drinking too much and drinking too much soy milk will raise your estrogen level. Carotenoids are light-absorbing pigments that give vegetables their color. It's the orange in carrots, it's the red in tomatoes, it's the orange in pumpkin, it's the green in broccoli, it's the white in cauliflower, it's the green in Brussels sprouts. Depending on the citrus fruit, most citrus fruits are yellow, and of course strawberries are red. Carotenoids are rich in antioxidants, especially beta-carotene, which is a good source of vitamin A. And of course, vitamin A is one of the things that you need. There are foods that fight cancer. They are protective. Garlic, onions, and leeks. These protect your breast and stomach, protects you from breast and stomach cancer. Selenium-rich foods like fish, liver, garlic, eggs, and whole grains protect the males from prostate cancer. Flavonoids are in red wine, grapes, apples, and cranberries. This reduces the risk of lung and colorectal cancer. Lycopenes are in tomatoes, red peppers, and watermelon. They can contain antioxidants which aids in cognition. So if you eat watermelon and red peppers and consume a lot of tomatoes, then you'll be really, really smart. Indoles, cruciferous vegetables have indoles. It reduces the risk of several forms of cancer. So eating cabbage, eating cauliflower, Brussels sprouts, broccoli, kohlrabi. If you've ever seen a kohlrabi, these are all cruciferous vegetables, and they have indoles in them, and they are actually quite good for you. Excessive drinking is a major risk factor for cancer of the upper respiratory and digestive tracts. Excessive drinking may also contribute to breast, colorectal, and liver cancer. Consuming 2 or more alcoholic drinks per day creates at least 25% greater risk of breast cancer in women. Animal research shows that drinking the equivalent of 2 to 4 drinks per day increases the growth of an existing tumor. So this is just a hint and a warning to those people who drink and have cancer. Not a good idea. You're actually making your tumor grow with the alcohol. Why? Because alcohol, of course, requires your immune system it activates your immune system, and it makes you try to protect the human body from the alcohol. For that reason, of course, it is taking that immune function away from fighting the tumor, and for that reason, the tumor grows larger. Lack of physical activity may be a risk factor for colon cancer in both men and women. Regular exercise, whether work-related or recreational, may protect women from breast cancer. 7 hours or more of exercise a week makes breast cancer 20% less likely. All you need to do is walk. Walking works as well as any other strenuous activity. Physically active women have lower rates of breast cancer than do sedentary women. Being overweight and obese increases the risk of cancer in the endometrium, the colon. The endometrium, of course, is the lining of your uterus. The endometrium is what sloughs off every month and gives women their periods. Colon, kidney, esophagus, pancreas, ovaries, and your gallbladder. In 2012, the CDC reported that 34% of U.S. adults are overweight, 35.9% are obese. So being overweight and obese is a risk of cancer. Exact causal mechanisms are not quite known, but we do know that people who are overweight or obese are more prone to cancers. Postmenopause obese women have a 1.5 times higher risk of cancer than their normal weight sisters. Being overweight as you wander into middle age increases your risk of early mortality 20 to 40%. 95% of breast cancer cases are non-genetic or due to other risk factors, such as obesity. Menarche at a young age is a risk factor. Lack of exercise. If you smoke, if you have a poor diet, if you use oral contraceptives, females, of course, if they use oral contraceptives, it used to be estrogen, but now it's both progesterone and estrogen. But it still can cause cancers of your reproductive area. The presence of other diseases of the breast, radiation exposure, use of alcohol. Families with inherited breast cancer show breast cancer in 2 or more close relatives. They have early onset cancer, breast cancer in more than one generation, cancer in both breasts of 1 or more family members, frequent ovarian cancers, if they're Ashkenazi Jews. Ashkenazi Jews are Eastern and Central European people of Jewish ancestry. They have a family history of breast and ovarian cancers. Other cancers that have a strong genetic connection: basal cell carcinoma, commonly the common localized skin cancer. This is a picture of a skin cancer on this individual's nose. He wears glasses, as you can see the marks on his eyes. He wears glasses, and the irritation from his glasses have created a basal cell carcinoma. Ovarian cancer has a genetic connection. Prostate cancer runs in families. Pancreatic cancer can run in families, as does laryngeal cancer. Various chemicals are clearly carcinogenic. No subfield of cancer has identified as many new toxins as looking at the carcinogens and chemicals. Asbestos, of course, we know is cancerous. It causes mesothelioma. Vinyl chloride is cancerous, as is arsenic. And of course, we put arsenic in a lot of poisons that we're trying to get rid of varmints and insects and whatnot. Some researchers believe that household cleaners that contain chlorine can be carcinogenic. Pest control products may increase the risk of breast cancers. So those of you who clean your house with household cleaners, chlorine's probably not the best thing to be wiping your house down with. Environmental toxins in the air, soil, and water contribute to an estimated 2% of fatal cancers. Bladder cancer, lung cancers. Municipalities will treat their drinking water with chlorine to curb cholera and typhoid fever outbreaks, which kill people quick. But of course, they may be causing cancers. They will also fluoridate their water to prevent tooth decay. Both of these increase the danger of bladder cancer. So despite the fact that they're putting it in your water, I guess they're trying to determine whether cavities, tooth cavities, or cholera or typhoid fever is a worst case scenario than the few cases of bladder cancer that they run into. Radiation, 40 to 50% of Americans who reach 65 develop skin cancer. As I've told you, I've had skin cancer. I've had three chunks of skin cancer cut off my body, one on my forehead. Oh, I can show you. One right here on my forehead. I had one on my right cheek. Yeah, I think it was my right cheek. And one right here off my throat, right there. This didn't have anything to do with sunbathing. It was mostly probably because I played a lot of softball. And of course, when you play in a softball tournament, you're outside all day in the sun, and there's not a whole lot you can do. I guess you can wear a cap. I don't like wearing hats, and of course, that may have something to do with the cancer on my forehead. But of course, there's no way of protecting this portion of your face. Or if you're wearing the wrong shirt, of course, this area right here is easily exposed. Ultraviolet B rays damage DNA and cause 90% of skin cancers. Many researchers believe that the frequency of sunburns in childhood may lead to skin cancer and even melanoma. And of course, when I was a kid, I didn't even think of whether I was sunburning my body. But I did sunburn from time to time, unfortunately. And it probably wasn't the smartest thing I ever did. Melanoma is a potentially deadly form of cancer that strikes the melanin-containing cells of the skin. Factors that may lead to an increase in melanoma: a thinning of the ozone layer protecting the Earth from UV radiation, and increased sun tanning and the use of tanning booths. And of course, all three of these things are reasons that we are seeing a lot more skin cancer. This is what melanoma looks like. It's not a mole. Moles are usually fairly symmetrical. Melanomas tend not to be. And of course, it's a cancer of the melanin. Melanin is the dark portion of your skin. Native Americans have darker skin than white people do, and the reason is because they have more melanin. Of course, African Americans people of African descent have a lot more melanin than white people do, and of course they have less cancer, and the reason they have less skin cancer is because the melanin filters out the sun. But they can develop skin cancer. They can also sunburn, as can American Indians. You guys can sunburn just like, well, not like me, because I sunburn I can sunburn fairly readily, but you're less susceptible to sunburn. Those with deepest tans are least knowledgeable about skin cancer, tend to be less knowledgeable about skin cancer. They tend to be more relaxed. They're more sensitive to the influence of peers who value a good tan. And when I was growing up, we didn't even think about skin cancer. Most of the people were dying in their 50s and 60s of lung cancer. So we never even thought about, about skin cancer. So we tanned ourselves brown. I can remember when I was young, I would work in the field on the tractor, plowing or disking or hoeing or whatever I was doing. And I would sit out there. I would just wear a pair of shorts and a pair of shoes, and I'd turn brown as a nut. I was just really, really dark. Of course, when you first go out there, you burn yourself, and then it turns into a tan. But we didn't think anything about it. We thought we looked healthy. The people that have the deepest tans tend to take other health risks, and of course that was one of them. They are more focused on their appearance, of course, and the darker your tan, the cooler you were, of course, back in the 60s and 70s. Immunocompetence is the overall ability. I had a friend named George. George was a really attractive man, but George I can't remember what he used as his sun tanning lotion, but he was our high jumper on the track team, and old George he would go out and he would lay on Saturdays and Sundays. We're in school. On Saturdays and Sundays, he would slather himself down with whatever this amazing sun tanning lotion was, and he would go and he'd lay in the high jump pit, and he'd lay out there for hours. And of course, by the time it was track season rolled around, of course he's doing this in the cold too. But he was, high jump pits, of course, if you lay down in them, they sink down, and he was kind of guarded from the wind and the cold. Anyway, by the time we started running, old George was gorgeous. His skin was nice and brown, and all the girls were just all over him. Strangely, George got married in our sophomore year, as did I, but he continued to tan like that. George was quite the fella. Anyway, he was a fun guy. He was one of my better friends. Anyway, George and his suntan, very, very and strong. He was very muscular. Immunocompetence is the overall ability of the immune system at any given time to defend the body against the harmful effects of foreign agents. Overall health, so what are we looking at? We're looking at overall health, the nature of life-threatening disease or foreign agents, and the stress that you have. This is how we can determine your immunocompetence. Really important right now that everybody's trying to fight off the coronavirus. How strong is your immune system? Potentially, if you have a strong immune system, even if you're 100 years old, you can fight this thing off. But you have to have a strong immune system. The immune surveillance theory is the theory that causes the immune system play a monitoring function in searching for and destroying abnormal cells, and that's the immune surveillance system. And that's what's going on now. One of the reasons why Corona is killing off so many people, why COVID-19 is killing off so many people, is that nobody has a natural immunity to this disease, to this virus. It's never been seen before. It's a mutation of the COVID-12 and I can't remember the other, COVID-9, I think. These other coronaviruses that we've seen, the MERS and the SARS virus. I told you that I was in a coronavirus outbreak in Germany back in the 81, I think. It was a walking pneumonia outbreak in the winter of 80 and the spring of 81. Anyway, so it's possible that I have not natural immunity. I have immunity to the coronavirus because I've been around it so much. The global immunosuppression model is an early theory that proposed that stress always suppresses immune responses. For the chronically stressed individual, this model purported that these individuals were more susceptible to infectious diseases and cancers. And I can tell you it's fairly stressful for me to live down in Saley. For one thing, it's you guys are 7,500 feet above sea level, and right now I'm about 430 feet above sea level. So just the elevation is stressful on my system. I'm away from my family. That's a tough one. Being away from my wife, I have to cook for myself, which is always painful. But I don't now. She's cooks for me. So it's a little bit easier to be here in Iowa than it is to be up in Saley. And of course, all I do when I'm up in Saley is I grade and I prepare lectures and whatnot. So it's a fairly stressful life up there. A little bit easier here since I have somebody. I don't have to sleep with myself, and I don't have to cook for myself. Biphasic model proposes that that only the most chronic stressors cause global immunosuppression. Short-term stressors may have no clinical significance, and that's probably true. The small irritations. What did she make me do today? Oh, she asked me, requested that I cut out these small mulberry trees while I was thinking about something else. My cat escaped to the barn last night, and I was afraid it would hurt him. But he's fine. He's fine, and I cut out the stumps, and everything's fine. Short-term stressor. So did it destroy my immune system? Nah, I'm fine. Childhood adversity has been associated with greater emotional and physiological sensitivity to stress. More difficulty dealing with adulthood stress. These individuals tend to have more difficulty dealing with adulthood stress. They have more pronounced cortisol and autonomic stress responses. So whenever they are in a stressful situation, they have a stronger response than people do normally. They have a disrupted cellular immune function and immune system dysregulation because of the excess of stress hormones they have anytime they're under stress. Signals, signs are signals that can be seen by others. Symptoms are signals that are felt or noticed by someone who has them. The signs and symptoms of cancer depend on where the cancer is, its size, and whether it has metastasized. Having one or more of these symptoms doesn't necessarily mean that you have cancer, but if a symptom has lasted for a long time or is getting worse, you should see your doctor. If you have unusual weight loss, if you have fever, anytime you have fever, it means something is going on, and you need to figure out what it is. It could be a cancer, it could be a virus, could be a bacteria, could be something is causing your body to react with a fever. Unexplained fatigue, pain. Pain is a good thing. Pain tells you when something's wrong. And of course, if you have pain that you don't understand, then you need to go see a doctor. If your skin is changing, if it's darkening in places, if it's turning interesting colors, if the beds of your fingers are turning strange colors like yellow or red, well, not red. Red is healthy. Or your gums, or the irises of your eyes, if they turn yellow, it means that you potentially have a liver problem. Pain or other changes in your liver, in your bladder, or your bowel habits. We don't talk about when you urinate and when you have a bowel movement. But the reality is that those areas of your body are very sensitive. And of course, if you have a sexually transmitted infection, it changes your bladder habits. If you have colon cancer, it's going to change your bowel habits. When I was working in the service, we had a gentleman that came in. This guy was dressed to the nines. He always was. Every time he came in for a medical appointment, he was always dressed up. He would come in and we would draw his blood. And of course, he always wore a suit and he always had to take off his jacket. Then he had to roll up his cuffs so that you could get to his antecubital area of or around his elbow. Just a wonderful gentleman. He was an old colonel, retired Army colonel. And this guy came in one time. One time he was on Coumadin. Coumadin is what they give you if you've had blood clots. And this guy had been taking Coumadin for about 5 years. And one night he came in and he was just sick. He looked like a sheet of paper. He was so white. And we drew his blood, and lo and behold, Coumadin builds up in your system. And so that's one of the reasons why you monitor it. Well, he'd missed a couple blood draws because he had been out to San Diego visiting his daughter. And when he came back, of course, he didn't have an appointment for another month or something like that. So he came in and he was a mess. I mean, he was really, really bad. What happened was he's had a break in his intestines that was caused by the fact that he had all this blood thinner in there, and he was bleeding out of his anus. He was bleeding into his feces, and of course, when blood gets into your feces, it changes the color of your feces. He was such a proper gentleman. He never looked at his feces. He didn't know what color it was. He didn't know that there was something in there. He didn't realize that he had a white stool because it was his hemorrhage was lower down in his bowels. But if it had been higher up in his bowels, his stool would have been tarry, would have been black because it would have broken down the blood vessels, the blood cells. But instead, of course, it was white. But he never looked at his stool because he was that kind of a proper gentleman. Anyway, he almost died because he didn't look at his poop. As strange as that is. If he had seen it that it was white, then he probably would have done something about it. It's something that we all do. We all urinate. I always look at my urine to see if it's cloudy. I always look at my urine to see what color it is, how much have I been drinking. This is all really important. You look at your stool. You need to see if there's any blood in there. You need to see what color it is to make sure there's not blood in it. If it's not tarry or hasn't turned white. Anyway, this is just something that everybody should do that hardly anybody does, and we don't even talk about it. Anyway, sores that don't heal, of course, that could mean that you have diabetes. White spots on your tongue or inside your mouth. The canker sores, these are known as canker sores, but they can also mean something else. They can mean a lot of different things. It can mean you have a vitamin deficiency. Unusual bleeding in any place on your body. That stuff's supposed to stay in your body. It's not supposed to come out unless you're a female, and of course that's not really blood. That's old blood that's coming out. It's not new blood. Any lumps in your breasts or other parts of your body. You could have a sebaceous cyst, you could have a fatty lipoma, but you could also have a cancer growing. So anytime you got a lump, you need to go in and see the doctor and make sure that it's okay. Indigestion or difficulty swallowing, that could mean you have throat cancer. Any noticeable changes in a wart or a mole, that could mean you have skin cancer or that you have melanoma, something that you don't want. A persistent cough that won't go away. Of course, this is a problem. This is how the coronavirus affects people. They get pressure in their chest, they become fatigued, and they have a persistent cough that is fairly unproductive. In other words, you're not coughing up a lot of phlegm. If you were coughing up the phlegm, you could get rid of this stuff. But unfortunately, it doesn't, produces a dry cough, and it's a persistent cough. But it's not productive. And that's coronavirus. And then, of course, the lungs fill up with fluid and the individual dies. Early detection can dramatically improve a person's chances of survival. Detecting breast and testicular cancer can be done with breast testicular Self-examination, something that you should do. It's not playing with yourself, it's checking yourself. So you need to if you're a male, you need to handle your testicles at least once a month, as frequently as you know. You just need to do it, okay? And what you're trying to feel is a lump. Self-examination is a source of detection of a majority of tumors in these organs. Women, of course, for the longest time, of course, they were too embarrassed to even touch their own breasts. But the reality is that that's the best way of testing for breast cancer, is trying to find a lump. And so you're supposed to do this once a month. It has something to do with your period, but I don't exactly remember when. But that's something you do in the shower. And the reason you do it in the shower is because of the warm water, and the warm water relaxes the muscles, and of course it makes it a little bit easier to feel for a lump. And of course the same thing with male and their testicles. Clinical breast exams should be done every 3 years for women between 20 and 40, and annually after the age of 40, because you're more susceptible to cancers, especially women who have gone through menopause, or hysterectomy. 30, or if you're taking estrogen supplements, real important. You don't want breast cancer. 30 to 50% of people who develop cancer wait 3 to 4 months before seeking medical attention. They know something's wrong. They're hoping it'll go away. They're hoping it's not cancer. They wait and they wait and they wait. Men are 10 times worse than women. It's just something's wrong with men, obviously. For people with a family history of cancer, genetic screening can assist in early detection. This gives the individual the option to have preemptive surgery to remove the organ that is susceptible to cancer. But this also raises ethical issues. Armed with this knowledge, should a responsible physician treat a child or even a young adult as if the problem is inevitable? Maybe they won't develop the cancer. How would you handle this information? Of course, this is a recurring problem. And this is a picture, this is a family picture of Angelina Jolie's family. And as you can see, lots of different forms of cancer. Here's Francine. Oh, wait a minute. Here's Francine. She was her second cousin. She died of breast cancer in her mid-40s. This is her great aunt, Stella. She had breast cancer, had a double mastectomy. She died later in her 70s after a successful surgery. This is Roland Bertrand, her grandfather. He had sweat gland cancer that killed him at age 61. This is Raleigh Bertrand, her uncle. He had prostate cancer and he died in his 50s. This is Debbie Martin, her aunt. She died of breast cancer at age 61. And this is her mom, Marceline Bertrand. She died of ovarian cancer at 56. And of course, so this gene, they have identified the gene that causes breast cancer, and she has it. She has the gene. So it wasn't very long ago, maybe 3 or 4 years ago, that Angelina Jolie had a double mastectomy to take away the probability that the cancer would kill her, like it did her aunt and her great aunt and her second cousin. They all had the same gene, so she had that done. She's also had a hysterectomy, and the reason she had a hysterectomy is for the same reason. Her family is susceptible to reproductive cancers. Diagnostic surgery is surgery to obtain a tissue sample that can be tested for cancer. This is also known as a biopsy. So if they thought I had testicular cancer, they would knock me out and they would take a tissue sample wherever they thought that the cancer was, and that would be a biopsy. If it was a young female then who had a lump on her breast, then they would go in and they would do a it has something to do with fluid. My brain isn't working this morning or this afternoon. Anyway, they would take a sample and they would look at the cells that they pulled out of the lump to see if they were cancerous. Preventive surgery is used to remove a benign growth that might become malignant. As in the case of Angelina Jolie, preventive surgery can be used to remove organs that genetics indicate might easily become cancerous in the future, and that's why she had preventive surgery done. Staging surgery is used to determine the extent of the disease. Laparoscopy can be done to gauge the degree of malignant growth and to take tissue samples. Once upon a time, I was playing soccer and the goalie hit me in the chest. He rugby tackled me, and I didn't know he was there. I didn't cover up. He hit me from he blindsided me and hit me in the chest on the left side, and he ruptured my spleen. Well, they weren't exactly sure if it was a ruptured spleen or not. So when they decided that they were going to do a laparoscopy, and what they did was he opened me up he opened me up beyond my spleen to make sure that I didn't have something else going on in there. It was an experimental laparoscopy. It was laparotomy. He cut me open. Laparoscopy can be you can use a small wire with a camera on it to look around. But he cut me open from the top of my pelvic bone to my sternum. I've got a scar that runs on the left side of my body. He took out my spleen. Curative surgery involves the removal of the tumor. Restorative surgery is used to reconstruct a person's appearance or the function of an organ or body part. And of course, they tried to sew everything back together. It didn't go together quite as well as it should have. Maybe I have a hard time. Developing a six-pack. I kind of have a three-pack on one side and a two-pack on the other side. Cancer surgery is associated with higher levels of distress and slower rates of emotional recovery than other surgeries. 60% of cancer patients will have some form of surgery. This lady, as you can see, has had thyroid cancer surgery, and they've taken out her thyroid gland. Chemotherapy is when medicines are used to treat cancer. Chemotherapy can destroy cancer cells that have metastasized. These toxic drugs are systemic drugs. I did this when I was going over this earlier. Systemic drugs that travel through the bloodstream to reach cancers in other parts of the body. Chemotherapy can be used to cure cancer, can be used to keep the cancer from spreading, can be used to slow the cancer's growth, can be used to kill cancer that is spread to other parts of the body. They can be used to relieve symptoms caused by the cancer, and that's why they use chemotherapy. This lady is just starting her chemotherapy. How do we know? Because her skin is nice and brown, it's nice and toned, and she still has lots and lots of hair. What will probably happen is, and she still has her eyebrows. What will probably happen, especially after they start radiation therapy, her hair will fall out and her skin will turn either red or it will turn fairly pale. Usually it's a red color. As you can see, this guy's awfully pale. Immunotherapy is a type of chemotherapy where the person's own immune system is enhanced to selectively target the cancer cells. Anti-cancer drugs are made to kill fast-growing cancer cells, but this can also affect fast-growing cells in the body like your blood cells, giving you anemia, cells in your digestive tract, giving you sores in the inside of your mouth and down in your digestive tract, making it very uncomfortable to eat. Cells in the reproductive system making you impotent, and your hair follicles, which will fall out. Your hair will fall out. Side effects, nausea and vomiting, as I said before, hair loss, of course, fatigue, mouth sores, bleeding, infection, and that infamous anemia. My sister was getting cancer treatment, and she it kept causing her to have anemia, and she would have to take erythropoietin in order to increase her red blood cells, or she would get a blood transfusion. Otherwise, she would have died of anemia. Strangely enough, anticipation of the side effects are sometimes worse than the side effects themselves. She was okay because she was fairly sedentary. She wasn't used to a lot of activity, and of course, it didn't keep her from doing what she normally did anyway, which was just sit around. Radiation is used to kill or damage fast growing cancer cells with X rays, gamma rays, alpha particles, and beta particles. Radiation usually knocks out the cancer, but normal cells that are affected tend to grow back. Tend to. I had a friend who had a brain tumor in his head when he was 14 years old. He had a brain tumor, and it was right in the middle of his brain. So they decided that what they were going to do was radiation therapy on that tumor. It was a fairly large tumor right in the middle of his brain. Anyway, they were cooking it with the radiation, and unfortunately, they killed his hypothalamus. And since they killed his hypothalamus, now he has to take all these really strange medications in order to just make him normal. As weird as that is, he also has a soft spot in the top of his head. Funny, funny guy. About half of cancer patients receive radiation therapy every year, about 350,000. It is the primary treatment for tumors of the neck, tumors of the head, early stage Hodgkin's disease, non Hodgkin's lymphoma, cancers of the lung, cancers of the breast, cancer of the cervix, cancer of the prostate, cancer of the testes, cancer of the bladder, cancer of the thyroid, and cancer of the brain, like my friend. Side effects include temporary permanent hair loss, fatigue, loss of appetite, skin rash, loss of white cells. He has a bald spot right on the top of his head. Now, the male pattern baldness is right in front of your cowlick, wherever your cowlick is. His is a little bit up from that because that's where they shot the radiation down into his brain, and he has this bare spot. It's not just bald; it has no hair follicles on it at all, and of course it can affect your white cells. And of course, if it affects your white cells, that can be a form of leukemia. People try alternative therapies to arrest or cure their cancers. Some of these work, of course, they make the person feel better, and that is the major reason for going ahead and doing whatever. Aromatherapy, biofeedback, meditation, music therapy, prayer and other spiritual practices, yoga, tai chi, art therapy, massage therapy, and herbal treatments. My sister adopted religion. She wasn't really big on Christian religions, so what she adopted Unitarianism, which is kind of an encompassing of all religions as far as that goes. Anyway, she became a Unitarian. The other thing that she did, I was working on the Fort Belknap Reservation at the time, and I had a good friend who was a healer, and she decided that she would, or I asked her if she wanted me to ask my friend if he would have a healing ceremony for her. And of course, and she said, sure, yeah, that'll be great. And so my wife and I stood in for her, and we had a healing ceremony for her. And up there, part of the healing process is tying fabric on trees in select directions. And afterwards, had to wear the we had to wear the fabric all night long. They had it in the evening. We had to wear the fabric all night long, and then before the sun came up, we had to go out and we had to tie this fabric on trees in select cardinal directions. Interesting night sleeping with all that fabric wrapped around our necks. Okay. Anyway, the other thing that she did, she went to England, and there is a spiral mound in England. And according to legend, if you walk up this mound, this spiral mound, and if you can make it all the way to the top, then it heals your ills. And of course, she did it when she had cancer. Obviously, it didn't work, and of course, she did die of cancer. So I don't know, but all of these positive things that she was doing made her feel better, and potentially that kept her from dying younger. 20 to 40% of cancer patients report elevated levels of affective distress. Many people will react to the disease even after treatment as being anxious, being angry, being hostile, and being depressed. And I can tell you that she really didn't have any of those problems. She kind of accepted her fate. The younger the age of onset, the more severe the affective distress. Fighting spirit among cancer patients is associated with lower mortality rate than denial, helplessness, or stoic acceptance. One of the things that my parents did, she was diagnosed with cancer when we were stationed in California. And one of the things my parents would do, they would fly me back to Indiana, where my sister lived, where everybody lived. And they would have me talk to my sister because I really pissed her off. And what they were trying to do, she was kind of passive and she was fairly sedentary. But the one person that could get her her blood flowing was me. The two of us were fairly combative with one another. We used to argue all the time. So they would fly me out when she started getting a little bit low. They'd fly me out, and she would treat me like a slave. I'd do it, I'd clean up her house, and I washed her windows one time. They were horrible. I I took an old TV antenna off of her roof. She had me doing all these little things just to punish me, I guess. Anyway, and she lived for 5 years with the cancer, and they projected that she would die within a year to 18 months, and she lived for 5 years. So something worked. Maybe it was the healer at Fort Belknap. Maybe it was a spiral mound. Maybe it was the fact that I pissed her off so much. Anyway, she lived longer than she was supposed to. The male ego is especially fragile when cancer threatens a male's common male behavior, his sexual response, his tolerance to pain, his natural vigor, his feelings of invulnerability. It can lead to an extreme reaction. Cancer-related masculine threat encompasses common symptoms associated with prostate cancer treatment, which threatens masculine self-image. High CMT scores are related to poor prostate-related functioning. Male cancers in cancer patients tend to be underrepresented in the media. Less than 10% of American men opt for active surveillance, where the doctors wait for the symptoms to worsen before they opt for any treatment. Men that opt out of active surveillance seem to have a difficult time accepting doing nothing. They want to be doing something. They want to fight the disease, as weird as that is. I used to play soccer. When I played soccer in California, I played on a men's team that was over 40 or over 50s. Anyway, we're pretty old. There were a bunch of Hispanics on the team. Nice guys. Anyway, one of them developed testicular cancer, and they put radioactive beads in his testicle to kill the cancer. Anyway, so he was not feeling 100%. But I'll tell you what, we used to practice, and when we practiced, he was the meanest guy you can possibly imagine. And of course, it was his reaction to the fact that all of these things couldn't take place anymore. He hurt, he felt weak, he felt vulnerable, and I'm imagining that he wasn't having sex with his wife. But I'll tell you what, he took it out on us when we were practicing against him. He hit me one time and knocked me probably 10 or 15 feet. I thought he broke my shoulder. Didn't apologize, didn't pick me up. Nicest guy in the world. Would have done anything for you before, but after he developed his cancer, of course, everything changed. We all accepted it. Breast cancer, African Americans report more difficulties with physical function and daily living activities. European Americans report more sexual difficulties than African Americans do. Latinas score higher on measures of distress than other groups. Filipinas report the most difficulties with emotional functioning. Lower socioeconomic status African American and Hispanic women are more likely to perceive benefits from breast cancer diagnosis than a European American, such as renewed focus on relationships in their lives. The idea that people can overcome challenges to experience a more hardy state is relatively new in health and disease research. Post-traumatic growth is a positive psychological change experienced as the result of struggle with a highly challenging life circumstance, greater appreciation for life, greater appreciation for personal strength, relationships with others, recognition for new possibilities in life, and of course, spiritual understanding. Most cancer patients displayed remarkable physical and psychological resilience to their treatment. Factors that lead to cancer adjustment include access to information, perceiving some degrees of control over treatment, being able to express emotions while feeling supported by others. And of course, this is one of the complaints about what's going on with these briefings from President Trump. A lot of times he doesn't tell the truth. And of course, that's really irritating people, select individuals, I guess, more liberal individuals, or maybe just people that hate him, or dislike him one way or the other. Anyway, this is one of the reasons why people have been doing so much complaining about what's going on, because he's not giving us good information. And he gives us information that doesn't help us control the situation. Procedural information regarding treatment has wide-ranging benefits, fewer negative emotions, reduced pain, and briefer hospital stays. Emotional disclosure is associated with better prognosis. Behavioral and psychosocial interventions may lower stress hormone levels, improving your immune functioning, and that's always a good thing, and that helps. Research has shown that social support can help cancer sufferers survive. Research of women with breast cancer showed that spousal support was associated with lower levels of depression, lower levels of anxiety, improved psychological adjustment to cancer, greater feelings of intimacy, and improved quality of life. Focus of psychologists trying to help cancer patients is on stress and pain relief, control of aversive reactions to treatment, and the enhancement of emotional well-being. In children, the focus is on increasing adherence and reducing suffering. The most widely used interventions are hypnosis, progressive muscle relaxation with guided imagery, systematic desensitization, biofeedback, and cognitive distraction. Intervention techniques that are used to increase conscious awareness include yoga, meditation, breathing exercises, cognitive training, exercise, and writing interventions to express emotions. And of course, my sister used writing interventions to express her emotions. Guided imagery is the use of one or more external devices to assist in relaxation and the formation of clear, strong images. It works because imagery triggers a state of relaxed concentration that enhances the person's sensitivity to health-promoting images. Imagery gives the patient an increased sense of control and a decreased sense of helplessness over stressful aspects of disease or treatment. Imagery may also work through the placebo effect. Systematic desensitization. I did this when I was practicing. Systematic desensitization is a form of behavior therapy used for overcoming phobias. The person is exposed to a series of increasingly fearful situations while remaining deeply relaxed. It is used to counter classically conditioned side effects of chemotherapy. And that is the end. So let me get out of here and let you guys go. We may have a lecture on the 8th. I'll see how I feel. We need to make up that extra chapter. I'm thinking we can cover everything, and that way I don't have to change the final. Okay.